Welcome to our next episode, How to Exercise Symptom-Free When You Live with Chronic Pain. A very big, meaty topic, one that I've talked about at length and one that I'm looking forward to sharing with you today. So if you search how to exercise with chronic pain, which you might have done before, you will find 1,000,001 search results. Chronic pain is a complex condition. A lot of people suffer with it. Billions of people globally deal with chronic pain, and we have no cure for it. It also costs countries a lot of money to work with chronic pain. It's a very expensive condition because we don't have a cure. A lot of it is just management. However, we have never been in a better time in human history to have chronic pain because we have more research than ever, we have more medical advances than ever to understand what's going on with our body, to understand pain. It is amazing the research that has come out in the last just 10 to 15 years about chronic pain. My background is in physical therapy. I used to treat patients, and the information that I'm going to be sharing with you and that I've applied to my clients is so far away from what we used to know, even what I learned in school. So I'm really looking forward to sharing this information with you and help you find solutions and the solutions that make the most sense for you. So I'm going to be sharing some models and frameworks to give us a good foundation of understanding chronic pain and what may be going on with your body and then what to do about it, the solutions. These frameworks I'm going to share with you on pain, one including one that I've created myself, are applicable to a wide variety of complex chronic pain conditions like degenerative joint disease, impingement, the tears, and more specifically, those mystery diagnoses or like kind of undiagnosed injuries where they say, oh, you just have this inflammatory condition where we don't really know what's going on with you. Your imaging is fine, right? You might have heard that before. So, if you're a woman with chronic pain who would love nothing more than to predictably be able to exercise and lift weights symptom-free and help get relief from your chronic pain, this episode is for you. This is the Feminine Strength Podcast. We share innovative strategies here to help women sustainably build a strong, fit body while supporting their hormonal health and their nervous system resilience, which we're going to cover today in this episode. I'm your host, Jess Mather. I'm a strength and rehab professional with over 14 years of experience helping thousands of clients around the world get stronger, healthier, and happier in their body. So we're going to be exploring your pain and your recovery through the lens of what I call the PPP method. You won't find this if you Google it because it doesn't exist on the Googles. This is something that I coined and created based on many other models of pain. So the PPP method, we are also going to explore the trauma, stress, pain trifecta, which lands under the PPP method, which is something that I coined as well. The trauma, stress, pain trifecta sounds scary, but it's really actually more fascinating than scary. So I coined the trauma, stress, pain trifecta concept when I was doing my research, where I created a series of continuing education courses that got accredited for licensed medical providers, for doctors, for behavioral health therapists, for other physical and occupational therapists, where we are looking at the relationship between trauma, stress, and pain. Very interesting conversation. One of my courses for these providers was called Enhancing Pain Relief Through a Deeper Understanding of Trauma Physiology. So I will be pulling from that presentation for this episode. So the PPP method that we're going to cover today that creates this foundation to help understand your pain and get relief when you're exercising in particular branches off of other established research models that help us understand chronic pain. These models are called the neuromatrix theory of pain, the biopsychosocial model, and gate control theory. Maybe those phrases are familiar to you if you've done some research on chronic pain, and they don't have to be either. We will also be exploring concepts around neuroplastic pain. Very interesting conversation around neuroplastic pain. And we're also going to be looking at the pain process itself very briefly, otherwise referred to as nociception, is the pain process, how pain is actually processed through our nervous system and our brain. We're going to be touching on that briefly as well. It's going to be a little bit of education and also a little bit of strategy in this as well. So let's go over this PPP method and how it can help you understand where there might be gaps in your recovery, okay, and you getting relief. So the PPP method stands for physical, physiological, and psychological. meaning there are physical, physiological, and psychological factors that will influence your pain and your pain experience. So we want to make sure we're addressing all of these three pillars to make sure that we can decrease that pain. So today we're going to be looking at whether you're addressing these three pillars and where, again, there might be some gaps that we can fill in. So let's start with the physical pillar. So the physical pillar asks, how can we support the physical body, your physical body, to move with less tension, compensation, and pain? How can we move differently? One of my favorite teachers, I have amazing teachers that I've learned from the past 14 years. One, he's a chiropractor and a little bit different of a chiropractor. He doesn't just do the pop, pop, pop. He's more of a movement-based chiro and uses a lot of other holistic interventions. And his name is Dr. Perry Nicholson. And he says it's hard to move well when you're used to moving from survival. It is hard to move well when you're used to moving from survival. So if you've been moving around in a state where you've been in a survival state, if you're experienced trauma or major injury or major stressors in your life, it's going to be hard to move well. It's going to be hard to move in a healthy fashion. So another thing is we tend to see this pattern in women. They will disconnect from parts of their body that they don't like or that they've had some sort of emotional or physical trauma in those areas. It could even just be a pregnancy, as pregnancy can be very traumatic for many reasons. It could be a sensitivity or disconnection from their hips, from their lower body in general. Usually we see this. So how can we expect them to move well from these areas to be able to connect with their core, for example, their breath, if they're almost shut down from those areas of their body? They're not going to be able to move well or breathe well. So again, to quote Perry, it's hard to move well when you're used to moving from survival or used to moving from stress or previous traumas or injuries. So usually when someone has pain, what they do when it comes to movement is they will either push through and ignore symptoms. They'll still work out, try to do things, but they're so disconnected from those parts of the body that they need to reconnect with in order to move better and decrease symptoms. They'll just push through and just ignore it. This will usually make the pain pattern worse. This I often see in men in particular, or women who have this tendency to just push through in life and drive through, and I just got to get things done. We're in that survival mode, right? Or we see on the other side of the coin, fear avoidance is what it's called. So this is where people will not do any movement at all or very little movement. They're afraid of flaring pain. They're in this protective response. Either they're consciously not moving, or unconsciously, their body is more stiff. They're not moving that part of the body that maybe has been injured. So the fear avoidance and also pushing through, neither are solving the problem on this physical level. So if you're doing one of those two extremes, it's not perhaps the best solution to move forward. But then it's like, well, what do I do instead, right? Like those are my options. So what we want to do instead is repatterning. I may use that word quite a bit in this episode. Repattern how your body is moving. So again, usually when somebody develops chronic pain, which is defined as having pain for 3 months or longer, it doesn't even have to be consistent. It's not like you have to have pain every day for those 3 months. Once people develops chronic pain after having the pain for that long of a time, it usually occurs after having an injury that heals and then the pain stays, after trauma or after stress. And then the subsequent result is chronic pain. So it changes how the body moves, and you start to move from a state of protection or from this state of survival. Your nervous system will actually inhibit strength and force output if there's a perception of threat in that area. So if I see a big strength discrepancy, for example, if somebody's super strong on their left and they're getting like half the reps on their right, it might not be weakness. It usually isn't weakness. It's usually the nervous system holding us back. So that's more on a localized level. We can't get the same strength output. We can't actually move well. And people say, oh, I'm just really weak on that side. When typically it's actually the nervous system inhibiting force output to protect us. So that protective, unconscious protective response. So what we want to do in these cases is we want to physically repattern the body out of protection, out of these states of survival, out of these states of threat. We're going to talk about that a little bit more under the physiological pillar. I use the phrase, we want to bring the body back to safety. Bring the body back to safety and get out of these habits of protection. Because right now, if that's the case with you, your normal movement is really just habits of protection. So there can be guarding, there can be the bracing, there can be this strength inhibition, compensation that's not helping anymore. Very similar to a trauma response. We developed a response that was there to protect us once in certain scenarios, but it doesn't serve us today. So very similar with chronic pain. So we want to repattern how the body is moving. We typically start with the feet and the breath for that. There's a whole thing we could go into about how to repattern the body into safety. That's a whole thing. But essentially, as long as you get that concept and you can start to move towards that and understand what that means for you, can be really helpful. So we want to repattern your body to move from safety and strength rather than threat and protection. That is the big goal under this physical pillar. So, are you personally relearning how to move and be physically in your body to come out of these survival states in a physical way, right? Not just like deep breathing exercises, but physically. How are you moving, repatterning how you're moving to get out of these states? When we do that well, it looks like magic. I used to joke, my clients would be like, oh my God, like my shoulder doesn't hurt anymore. I'd say, poof, we poofed it away with a magic wand. And now everybody uses the phrase poof as like manifestation, like poof, created that, created that. It actually, we created that phrase because clients would say, oh, it's like magic. When we repattern the way that the body's moving, we're not provoking things anymore. And then it's like, poof, the pain immediately disappears. And then we just continue that same pattern so that the pain does not come back. So we only want to load with exercise, so circling back around to really doing exercise instead of just movement. We only want to load with exercise using external forces like dumbbells or kettlebells or even bands, any sort of resistance, when the nervous system gives us permission. So there's this phrase that goes, strength is granted by the nervous system. We don't build strength, it's granted by the nervous system. So we want to almost get this permission, we can call it, from the nervous system to be able to pass go and actually load our movements. We want to move unloaded first, really perfect our body weight movements in a really calculated, sequential, orderly way. It's not random. And then we can start to load the movements. I call this the rebuilding body system. There's primarily 6 key movements that I work through with clients to work them up in this sequential manner, and then we load after. So it sounds like common sense, right? Okay, don't load the tissue before it's ready. But sometimes we get excited and we want to skip through, or we want to also assume a yoga or stretching class is going to be gentle enough for us. Gentle enough is going to be tailored movements at the right amount and the right intensity where we can actually control variables. Otherwise, we're just doing random things and we have no idea what's provoking you. So if we just jump into gentle classes, it could still be too much too soon too fast, and then it can also be discouraging. We're like, well, I can't even do a damn yoga class or like these really gentle classes or my body flares. Not necessarily. It just means that it's just not correct for you in that moment. So movement is medicine, right? So we need the right prescription, we need the right exercises, we need the right dose, the right intensity of the exercise at the right time, and we need the right frequency or the right volume, the right amount of work. Okay? So just keep that in mind a little bit on that physical pillar. Want to move your body into safety. What does that look like for you? On a physiological level, that's our next pillar, physiological. So I mentioned the body seeks safety, or we want to return the body back to safety. That is so key. We want to turn down the alarm bells of pain. Pain is an alarm bell. It's a request for change. Doesn't mean that tissue damage is happening. It means, hey, I don't know, something's a little sketch here, and we want to listen. So we know through these models of pain, the neuromatrix theory of pain, the biopsychosocial model, and gate control theory in particular, we know through research in these models that stress increases pain sensitivity. We know that stress increases pain sensitivity. You probably experienced this before. There's also a phrase you might be interested in knowing about, what I mentioned earlier, is neuroplastic pain. Neuroplastic pain says that chronic pain is a conditioned protective response. So it doesn't matter as much about what's going on with the physical damage, but it's a conditioned protective response. You might have heard the phrase neurons that fire together, wire together. So under this concept of neuroplastic pain, there's this idea that we have neural patterns of pain. Even if there's no damage occurring when we're doing something, but we're pain. Or even if we look at an MRI and the imaging is fine, we can still experience pain. So we look at what are the neural patterns here? What are the patterns of pain, even if everything looks okay on the surface? Because pain is not always a structural or physical problem. It's not always going to show up in an MRI. What's also interesting is that there's a lot of research on this and studies done of that you could also have terrible imaging, so to speak, and you could have no pain, right? Pain is complex, right? It has to do with the brain. So we know that structural damage is not always correlated to the amount of pain someone is in. There has to do with the nervous system, also has to do with the brain. So under the idea of neuroplastic pain, where it's more of this neurological pattern of pain just repeating itself, and that stress also increases the pain sensitivity. We see that things like worrying can make pain worse, putting pressure on oneself. We see that people with more of a personality that's perfectionist, we see an increase in pain sensitivity, or they have a higher risk of also experiencing chronic pain if they have a perfectionist attitude. People with high levels of self-criticism, we see they also have high levels of chronic pain or higher risk of having chronic pain. I see this with clients as well. They'll constantly check in or test to see if the pain is there. We don't want to do that. We don't want to reinforce the neural patterns of pain of anticipation. Is it there? Is it not there? Is it getting better? Is my pain going to start? Usually happens on an unconscious level, very hard to break out of because we want to protect ourselves, but just something to keep in mind. Do you constantly check in, or are you testing, reinforcing that neural pattern of pain? So stress and fear drives neuroplastic pains, or this pattern of pain, by increasing the hypervigilance, the stress response, and we become preoccupied with our pain. When we become preoccupied, we're increasing the stress response in our body. We have these neurophysiological changes, and we also change our behavior. So that's where we might have compensation patterns. We might breathe differently. We can see that people have a decreased parasympathetic activity. That's more of our rest and digest. We see when people are worrying and putting pressure on themselves, we also see that there can be an increase in inflammation, which can drive pain sensitivity. Compromised sleep and recovery, which is so important. Increase in muscle tension. All of these things. Unhealthy coping behaviors, where we eat a bunch of sugar or food or alcohol or drugs, and then that increases inflammation or pain sensitivity. We see people have a lot of shame or guilt, and then that can also drive the pain as well. Even as you're listening to this, I'm also thinking in my head, like, I hope you're not feeling like shameful. It's like, oh my God, now I'm causing my pain because, I'm thinking worrisome thoughts and I'm anticipating pain. Like, we want to get out of that. There is a doctor. I really like his work. He's considered one of the best back specialists in the world, Dr. Stuart McGill, and he says, you behave and you will create your pain. You will behave and you will create your pain. So what essentially he is saying is that we have so much control over our pain, and usually it starts at how are we thinking? What is our nervous system doing? Are we stressing ourselves out? The other thing is, if we look at this from the perspective of the polyvagal theory, if you've heard of that, polyvagal theory coined by Stephen Porges, polyvagal theory would say when we're in this place of worry, stress, perfectionism, self-criticism, we are more in a sympathetic state, in a fight or flight, versus a state of healing. An environment of healing would be what we call a ventral state, which we could also refer to as that physiological state of safety is ventral, state of connection. So we really want to bring you guys up to a state of ventral as much as possible, decrease that sympathetic state if we're looking at it from that physiological lens. So a question for you, how is your stress? How are you managing your stress? How are you managing your inner talk, which we'll talk about a little bit in the next pillar? What about the pressure you put on yourself, the shame or guilt? So I mentioned the trauma, stress, pain trifecta, the intimate relationship between trauma, stress, and pain. So as you can see already, there is this connection between stress, our former traumas. Usually, if we're harder on ourselves, perhaps there was a trauma from our childhood that created that pattern in us. So essentially, we want to be considering that pain is really a holistic condition. right? We want to tend to that physiological safety, our nervous system, our worries, our fears. That's very, very important when it comes to chronic pain recovery. There's a quote I want to leave for this pillar. It's harder to feel hurt when you feel safe, happy, and loved. It is harder to feel hurt when you feel safe, happy, and loved. So that reflects back to our ventral state. A ventral state is a state of connection with ourselves and with others. When we're in that state of physiological safety in ventral, that state of connection, it's usually harder to feel pain. And we see that represented again in these evidence-based models of pain, the neuromatrix theory of pain, the gate control theory. So love is very important in the healing process from chronic pain. Next pillar is psychological. So our psychological pillar is very, very important and leans on our physiological pillar. You probably have heard the quote, whether you think you can or can't, you're right. Very classic quote. So our beliefs, thoughts, our internal narratives play a huge role in our recovery. We know that even anticipating pain, even if it's unconscious, we're not conscious that we're anticipating pain, it can increase pain sensitivity. We don't want to anticipate pain. Okay. There is a physician that would say pain is an opinion of the brain. Pain is just an opinion of the brain. We've heard before a doctor saying, oh, it's all in your head. And sort of, that's a bit of a dismissive way to put it. So I always love the quote, pain is an opinion of the brain. Very interesting. So what this doctor is referring to is nociception, which is the process of pain. So we're not going to detail about the process of nociception, but essentially you have four kind of phases of how we process pain. It's transduction, we have transmission, modulation, and perception. That's the phases. What we want to pay the attention to here, especially in this psychological pillar, is perception. That's what he means by pain is an opinion of the brain. Our brain starts to form an opinion, so to speak. So perception is the subject analysis of these sensory signals coming into our body, where our brain will make this decision about what we feel. Our brain decides what we feel when we're experiencing an injury or pain. So things that influence this perception would be our attention, where our focus is, our expectation or anticipation, our past experiences, and also our limbic system, which we talked about in the physiological pillar, our stress states. There's a really classic story about, this is in one of my amazing pain books called Explain Pain. There's this story in the book about this man who he's a worker, he's in a construction site, and he's wearing his boots and he steps on a nail and the nail goes right through his boot and he freaks out. He's screaming, he's in so much pain. He immediately gets rushed to the hospital. Go to the hospital, they take his boot off and they say, oh, the nail went right between your toes. It didn't even impale you. It didn't even touch you. And immediately his pain goes away. He was anticipating pain. He had all of this input coming in like, oh my God, this nail went through my freaking foot. So his brain formed this opinion of, oh my God, we're going to create the experience of pain because this nail went through your foot. When really, as soon as he saw, oh, like nothing actually happened, then he was fine, right? His stress response was super high. So that's a really classic example of what we're talking about here. So what is the story we're telling ourselves about our pain? Just like the guy who stepped on the nail, his story was, oh, it impaled my foot, like I'm bleeding out, right? That was not true, but his brain believed that story and his body responded in kind. So what is the story we're telling ourselves about our pain, and can we challenge that story? This does not mean dismissing our experiences. This does not mean using positive psychology, really important. It's just a bit of a cognitive reframe. So in trauma therapy, we say, how can we be with what is without changing it? How can we be with what is without changing it? How can we sit in what is here in this experience right now? We use somatic practices sometimes to do this. Somatic practices are amazing for chronic pain. I refer to them more as neurophysiology exercises. So these practices can help us relate to our sensations and our pain story differently. We're repatterning out of our protective movement patterns, number one. We are relating to our sensations and our pain story differently. And then we're returning back to that state of physiological safety. Those are our pillars. physical, physiological, psychological. All of those are so important. So with that said, do you feel like there's a gap somewhere with your recovery? You can look at that. Okay, is it my thoughts? Or like my thoughts are really negative about my pain? I'm telling a really scary, terrible story about my pain. I'm not able to have some sense of peace with this. I'm not really moving at all. I have fear avoidance, or I'm pushing through, or oh, my system is so stressed out. Like maybe I'm in an adrenal fatigue. We talked about that in the last episode. Um, I'm creating more stress in my body from these stressful thoughts. Where do you see the gap? That can at least get you started. So I mentioned the rebuilding body system where I will take 6 main movements to apply the physical pillar, and we work through those movements, but we also address the other pillars. And we apply the system into Feminine Strength, the program that we have been talking about in these episodes. This is Feminine Strength is a program for women to build a healthy and fit body while working with their body's unique needs, including if there's injury or pain, and their monthly rhythms, their monthly cycle. I'm also going to leak in here the secret word for this podcast. If you collect 8 of these secret words, then we'll give you 10% off the Feminine Strength program. The secret word for today is the word nail. Nail, just like we talked about the nail in the shoe. So save 8 of those words and we can give you 10% off the program. So I hope this was informative for you. Got some information. We went really like big overview. There's so much more depth to talk about this, but I hope this was encouraging and inspiring for you. Just know that you're not alone either with chronic pain. Most people, again, billions of people suffer from chronic pain. Most people need to be mindful about reactivating an injury or pain. Most people, especially as we get older, life is happening. And many women, mostly women, have autoimmune disorders, which also drive inflammation, pain sensitivity. An autoimmune disorder that's not quite regulated and there's high levels of inflammation, oh my goodness, like pain can be next level. Autoimmune disorders is a whole other topic when we're talking about pain as well. So essentially what it comes down to is we want to heal. We want the body to feel safe on that physiological level. We want to reduce being too hard on ourselves. We want to move in ways that are therapeutic for you. I call it therapeutic strength. See where your gaps are. Start to identify those gaps. If you need help, you're welcome to email me at hello@rebuildingbody.com. Hello@rebuildingbody.com. We address pain in all of our weightlifting programs. If you'd like to look more at feminine strength, that link is rebuildingbody.com/feminine strength. I often say to clients, your body gets to feel good regardless of what happened to you. Okay? Hope that was an informative class. I always have fun talking about chronic pain. I find it very, very fascinating and rewarding as well to see the relief. So we will connect soon in the next episode. Bye, guys.